So the screen, hope it's clear and you can just read the question, and very important questions മാത്രമാണ് ട്ടോ ഞാൻ ഡിസ്കസ് ചെയ്യുന്നത്. And additionally, whatever points that I'm going to discuss, please note it down. Fine. So the nurse is aware that an adoption of pregnancy is an increased blood supply to the pelvic region that results in a purplish discoloration of the vaginal mucosa. So what it is known as. Okay, purplish discoloration of vagina. അതിന് purplish discoloration of vagina ക്ക് പറയണ പേരെന്താണ് എന്നുള്ളതാണ് ക്വസ്റ്റ്യൻ ഇവിടെ. Okay, ലെഡൻ സൈൻ ആണോ, ഹെഗാൾ സൈൻ ആണോ, ഗുഡൽ സൈൻ ആണോ, ചാഡ്വിക് സൈൻ ആണോ? So what it is considered as. Okay, ഇവിടെ നമുക്ക് ഡയറക്റ്റ് ആൻസർ സെലക്ട് ചെയ്യാം, ബിക്കോസ് ഇത് ഡയറക്ട്ലി നമ്മൾ പഠിച്ചിട്ടുള്ളതാണ്. ഡ്യൂറിങ് പ്രഗ്നൻസി ദ ബ്ലഡ് സപ്ലൈ ഓൾവേസ് ഇൻക്രീസസ് ആൻഡ് ഇറ്റ് കോസസ് bluish discoloration or purplish discoloration. It is called as Chadwick sign. Okay, so the answer for this is Chadwick sign. Clear? This pregnancy related ആയിട്ടുള്ള ഒരു question ആണ്. Clear? Our purplish discoloration. Why purplish discoloration or bluish discoloration is expected? It's because of, yes, blood supply, variation in blood supply. Clear? Now, I'll maximum prefer labor and like newborn related questions. Okay. Next, read the question. This is the question. I'll just mark the question. You can just read the question. This. The client arrives at a birthing center. It's labor room. In an active labor, and her membrane are still intact, and the nurse midwives prepare to perform an amniotomy. The nurse who is assisting the nurse midwife explained to the nurse that after this procedure, she will most likely to have. Okay, so the question is, she is in an active labor. Okay, so active labor ലായിരിക്കുന്ന ഒരു അമ്മയാണ്. എവിടെയാണ്? ലേബർ റൂമിൽ. Okay, and her membrane is still intact. And now remember, stages of labor, it's usually there are 4 stages, right? And then first stage is further divided into 3 phases that we already discussed. What are the 3 phases? Latent phase, active phase, and transition phase. Okay, and what is latent phase? The cervical dilation reaching up to 3 centimeters, 0 to 3 centimeter. When cervical dilation increases from 4 to 7, it is considered as active labor. So active labor, where that means the cervical dilation is either 4, 5, 6, or 7. Okay, so that is any one of this would be the cervical dilation, and the entire cervical dilation from 4 to 7 is considered as an active labor. Okay, and the membrane is intact. What is the membrane? Like the amnion. Fine, where it is encloses amniotic fluid. So membrane intact ana, and preparing for amniotomy. What is amniotomy? Opening the amnion and let the amniotic fluid move out. Fine. Usually after amniotomy, നമ്മൾ amniotomy ചെയ്ത് കഴിയുമ്പം there will be chances to get a gush of fluid moves out. Fine. Immediately when the fluid move out, the fetus has to adopt that, or the fetus has to compensate that. Real. So the fetus will have a rapid movement. Okay. And while amniotomy, you have to closely observe the color of the amniotic fluid. Okay. And fetal well-being, how would the fetus compensate the situation, is also very important immediately after amniotomy. Okay, so what need to be assessed? Okay, so the she will most likely to have, അതായത് amniotomy കഴിയുമ്പോൾ എന്തായിരിക്കും ഉണ്ടാവുക. So we will read the options and wrong answer will remove. Option 1 says less pressure on her cervix. Cervixലേക്ക് less pressure ഉണ്ടാവുന്ന. Already in a amniotomy, the entire fluid will move out. With the same pressure, the fetus will also come down. Fine. So the pressure usually will increase towards the cervix. An increased efficiency of contraction. Contraction increases. That can be expected. Okay, contraction rate ഭയങ്കരമായിട്ട് കൂടാനുള്ള ഒരു ടെൻഡൻസി ഉണ്ട്. Decreased number of contraction, that never happens. Always amniotomy causes increasing of contraction, not decreasing of contraction. Okay, and the need for increased maternal blood pressure monitoring. Normally, we have to monitor fetal heart rate, not the maternal blood pressure. So what is the answer for this? Is ഇതിനകത്ത് ആൻസർ ഏതാണ്? increased efficiency of contraction. Okay. അപ്പം ഇവിടെ നമ്മൾ additional points what you need to remember is after amniotomy you have to monitor fetal heart rate. That is very, very important. Amniotic fluid color has to be assessed. Greenish amniotic fluid is indicating meconium passing, which is meconium aspiration, I would say. So color of amniotic fluid is very, very important. Okay. And if it is thick amniotic fluid, it would be indicating either term or post-term. Thin amniotic fluid or just a diluted amniotic fluid, if there is no color, it is indicating preterm. So in amniotic fluid, you have to check color, consistency. Clear? Immediately after amniotomy, we have to monitor fetal heart rate. Okay, and the amniotomy will increase the contraction. So as a result of contraction, when contraction rate increases, there will be chances to get an acceleration of fetal heart rate. The fetal heart rate usually will increase. Okay, why amniotomy is important? That increases the contraction and it always allow the fetus to move down. So descent of fetus will increase in as a result of amniotomy. Okay, amniotomy, it is like a procedure and it voluntarily, I'm sorry, like spontaneously the amniotic membrane can also get ruptured. So spontaneous amniotomy under and there is a procedure as well. Okay, അപ്പോൾ ഇത് രണ്ടായിട്ടും കൺസിഡർ ചെയ്യാം. ഒരു പ്രൊസീജിയർ ആയിട്ടും കൺസിഡർ ചെയ്യാം അല്ലെങ്കിൽ അത് സ്പോണ്ടേനിയസ് ആയിട്ട് നടക്കുന്നതായിട്ടും കൺസിഡർ ചെയ്യാം. ഓക്കെ, അടുത്ത ക്വസ്റ്റ്യൻ നോക്കൂ. The nurse is monitoring client in a labor and the nurse suspect that umbilical cord compression, if which of the following is noted on an external monitor tracing during contraction. Okay, so what is the condition here is umbilical cord compression. Please write down umbilical cord compression. Okay, അപ്പോൾ ആദ്യം നമുക്ക് നോക്കാം എന്താണ് umbilical cord compression എന്ന്. Umbilical cord is protruding out. Okay, and the fetal head when that move down, it may compress the umbilical cord. അതായത് umbilical cord ഇന്റേണൽ ഓസ് വഴി അല്ലെങ്കിൽ സെർവിക്സ് വഴി മൂവ് ചെയ്ത് പുറത്തേക്ക് വരികയും fetal head അതിനെ കംപ്രസ് ചെയ്യുകയും ചെയ്യും. Okay, when umbilical cord get compressed, the blood supply towards the fetus will reduce. So umbilical cord compression reduces blood supply or oxygenated blood supply towards the fetus and it causes cyanosis. Clear ayo? Okay, and what is the sign of umbilical cord compression? Basically for umbilical cord compression, the sign is pulsatile mass on vagina. Please write down pulsatile mass in vagina is the sign of umbilical cord prolapse. Okay, and when you assess detail on assessment, variation in fetal heart rate is also expected. Okay, so variation in fetal heart rate. What is the normal fetal heart rate? 120 to 160 is the normal fetal heart rate. Okay, so decrease from 120 is called as deceleration. Increase from 160 is called as acceleration. Deceleration of fetal heart rate and acceleration of fetal heart rate. Okay, normally during contraction, fetal heart rate will increase. That means uterine contraction usually causes acceleration of fetal heart rate. Okay, അപ്പോൾ യൂഷ്വലി എന്ത് സംഭവിക്കുന്നത്? ഫീറ്റൽ ഹാർട്ട് റേറ്റിന്റെ അളവ് കൂടുക, ആക്സലറേഷൻ ആണ് ഉണ്ടാവുന്നത് ഏത് സമയത്താ? കൺട്രാക്ഷന്റെ ടൈമിൽ. Okay, which is quite normal. But there is chances to get a deceleration of fetal heart rate as well. Okay, and the deceleration is divided into 3. Normally deceleration നമുക്ക് മൂന്നായിട്ട് ഡിവൈഡ് ചെയ്യാം. Early deceleration, variable deceleration, late deceleration. Okay, early deceleration, variable deceleration, and late deceleration. Okay, early deceleration is because of compression of the uterine part or the soft tissues. It is quite considered as a normal one. Early deceleration, that means it's a normal one. And you should understand what is early deceleration. That means deceleration of fetal heart rate can happen before the peak of contraction. ഒന്നുകൂടെ പറയാം. Early deceleration, which means deceleration happens before the peak of uterine contraction. So what is late deceleration? Deceleration happens after the peak of uterine contraction. Uterine contractionന്റെ പീക്കിലാണ് സാധാരണ ഡീസലറേഷൻ സംഭവിക്കുക. ഏർലി അതായത് ഡീസലറേഷൻ നേരത്തെ നടന്നു, അത് കഴിഞ്ഞിട്ടാണ് കൺട്രാക്ഷൻ നടന്നതെങ്കിൽ അതിന് ഏർലി ഡീസലറേഷൻ എന്നും, യൂട്രൈൻ കൺട്രാക്ഷൻ കഴിഞ്ഞിട്ട് നടക്കുന്നതിന് ഡീസലറേഷൻ നടന്നാൽ അതിനെ ലേറ്റ് ഡീസലറേഷൻ എന്നും പറയും. Late deceleration is because of uteroplacental insufficiency, decreased blood supply towards the placenta. And variable deceleration is deceleration of fetal heart rate happens not only in the contraction, it can even happens in the relaxed mode as well. So that is considered as a variable deceleration. Variable degree of deceleration. It is not only expected in contraction, even if that is expected in relaxation of the uterus as well. Okay. And this is indicating, variable deceleration is indicating umbilical cord prolapse. Reason for all these deceleration is very, very important. Late deceleration is because of uteroplacental insufficiency. Early deceleration is because of compression. It's like a normal thing. And variable deceleration is indicating umbilical cord prolapse. What is the sign of umbilical cord prolapse? Like protruding a pulsatile mass at vagina. Okay, how do we manage? Immediately you have to provide a head low position to the patient. Okay, അപ്പോൾ ഇവിടെ പേഷ്യന്റിന് എന്ത് ചെയ്യണം? ഹെഡ് ലോ പൊസിഷൻ കൊടുക്കുക. എന്തിനു വേണ്ടിയാ? അംബലിക്കൽ കോഡ് പ്രൊലാപ്സ് ഉള്ള പേഷ്യൻസ്. ക്ലിയർ ആയോ? This is all about deceleration and what are the different types of deceleration and its management. Okay, so in case of umbilical cord prolapse, variable deceleration is expected. Immediately you have to provide a head low position. Clear? Next question, please read this. The nurse explains the purpose of effleurage to a client in an early labor. The nurse tell the client that effleurage is. So what is effleurage? Okay. So options directly വായിക്കാം. Have you heard about effleurage? എന്താണെന്ന് കേട്ടിട്ടുണ്ടോ? effleurage എന്ന് പറയുന്നത്, you can just read the option. You can just go through the option and then I'll explain. Normally, effleurage എന്ന് പറഞ്ഞാല് it is like a stroking, a light stroking എന്ന് നമുക്ക് പറയാം. Okay, it's like a tactile stimulation. Simply tactile stimulation കൊണ്ട് യൂട്രസിനെ stimulate ചെയ്യുന്നതിന് പറയുന്ന പേരാണ് effleurage. Okay, option 1 says a form of a biofeedback to enhance bearing down effort. No, it's wrong. Light stroking of the abdomen to facilitate relaxation during labor and it provides tactile stimulation. Yes, that is effleurage. Okay. And the application of pressure to the sacrum, no, it is wrong. And D is also wrong. So what is the correct answer for effleurage? It is light stroking. It is a tactile stimulation. മനസ്സിലായോ? Tactile stimulation is very important. അപ്പൊ എഫ്ലുറാജിന്റെ ബെനിഫിറ്റ്സ് നമ്മളോട് ചോദിക്കാം. ഒന്ന്, ഫിംഗർ ടിപ്പ് കൊണ്ട് നമ്മൾ ചെയ്യുന്ന ഒരു ടാക്ടൈൽ സ്റ്റിമുലേഷൻ ആണ്. ദാറ്റ് ഓൾവേസ് ഹെൽപ്സ് ടു റിലാക്സ് ദ മസിൽസ്. ഓക്കെ, സോ മസിൽസ് ഭയങ്കരമായിട്ട് റിലാക്സ് ചെയ്യാനായിട്ട് ഹെൽപ്പ് ചെയ്യുന്ന ഒരു സ്റ്റെപ്പാണ് എഫ്ലുറാജ് എന്ന് പറയുന്നത്. ക്ലിയർ? സോ ഇറ്റ്സ് വെരി ഇമ്പോർട്ടൻറ്റ് ടു റിമെമ്പർ. Another question. അടുത്ത ക്വസ്റ്റ്യൻ. അപ്പൊ എഫ്ലുറാജ് ജസ്റ്റ് നോട്ട് ചെയ്ത് വെക്കണേ എന്താണ്. ഇറ്റ്സ് സ്റ്റിമുലേറ്റിംഗ് ദ muscles. Okay, and it relaxes the muscles, and effleurage always increases the circulation as well. Okay, and yeah, next question is, the nurse is caring for a client in a second stage of labor and the client is experiencing uterine contractions every 2 minutes and the client out of pain with each contraction. The nurse recognizes this behavior: exhaustion, fear of losing control, involuntary grunting, and Valsalva maneuver. So you can just go through, understand. First of all, the question you should understand. Here, the patient is experiencing uterine contraction every 2 minutes, which means it's a strong contraction. Okay. And the patient is cries out. Okay. Cries out with the pain with each contraction. So it is because of what? എന്തുകൊണ്ടാണ് ഇവരിങ്ങനെ cry out ചെയ്യുന്നത്? Okay. This is not a very small child. It's like a matured woman. And she is just crying out with every contraction. And this particular behavior is indicating what? Okay, so this is indicating a fear of losing control. അവരുടെ കൺട്രോൾ ലൂസ് ആവുന്നതിനെയാണ് ആ ഒരു നമുക്കൊന്നും ചെയ്യാൻ പറ്റാണ്ട് പെയിൻ കൺട്രോൾ ചെയ്യാൻ പറ്റാതെ വരുമ്പോഴാണ് എന്ത് ചെയ്യുന്നത് കരയുന്നത്. ഓക്കെ, അപ്പം ഒരു പെയിൻ സിവിയർ പെയിൻ ആൻഡ് നോ വൺ ഈസ് ഏബിൾ ടു ഹെൽപ്പ് and she is not doing anything, she is not able to control things, and she is getting literally a kind of a panic situations. Okay, and these are the reason why she just cries out. Okay, പൊറക്കനെ കരയണതിന്റെ reason fear of losing control ആണ്. Clear? So ഇതാണ് ലേബറിൽ ഒരു ക്വസ്റ്റ്യൻ ആണ്. അപ്പൊ ഇങ്ങനെയുള്ള ക്വസ്റ്റ്യൻസ് ആണ് നമുക്ക് കൂടുതലായിട്ടും വരിക. ഓക്കെ, അടുത്ത ക്വസ്റ്റ്യൻ നോക്കൂ. The nurse is assigned to care for a client with hypotonic uterine dysfunction and signs of slowing labor. The nurse is reviewing the physician order and would expect to note which of the following prescribed treatment for this condition. ഇവിടെ uterine dysfunction ആണ് and the contraction is much lesser. അതുകൊണ്ടാണ് ഇതിനെ എന്തെന്ന് പറയുന്നത്? Hypotonic contraction, uterine dysfunction എന്ന് പറയുന്നത്. Uterine contraction is not happening properly, so it is considering as a hypotonic contraction. So usually we can consider the uterine movement as two: hypertonic, hypotonic. Okay, hypotonic എന്ന് പറഞ്ഞാൽ contraction strong ആയിട്ട് നടക്കാത്തതിനെയാണ് hypotonic ആയിട്ട് കൺസിഡർ ചെയ്യുന്നത്. What is hypertonic? Uterine contraction are like happening very fast, okay, and strong. It's called as hypertonic. This is hypotonic. If there is hypotonic contraction, definitely the labor process will reduce. Okay, so what medicines you have to administer? You know, like what medicines induce contraction? Out of this, inducing the contraction inducing medicine is oxytocin. Okay, so the medicine is oxytocin. And what is last option says? Administration of tocolytic medication. Tocolytic medications are the choice of treatment for hypertonic contraction. Contractions is strong angle. In order to reduce contraction, what is given? Tocolytic agent. Duodenone is an example. Okay, so that is given. Medications that will provide sedation. Sedation definitely will sedate the patient, but it will not act on the exactly, it is not acting on the uterine muscles. Okay, so and when you give sedations, hypotonic contractions will worsen. Okay, അപ്പം അത് പ്രത്യേകം ശ്രദ്ധിക്കുക. Oxytocin increases uterine contraction. Clear ആയോ? Okay, before administration of oxytocin, this is another point, like, so see all the other points you have to just note it down in a box. Okay, make a box and write it down. Before administering oxytocin, what need to be assessed? It is fetal heart rate need to assess before administering oxytocin. Okay, because oxytocin always causes increased uterine contraction, and already I said like contraction causes acceleration of fetal heart rate. So we should have a proper idea that what is happening. Fine. So other or proper idea നമുക്ക് അറിഞ്ഞിരിക്കണം. അതുകൊണ്ട് before administering oxytocin, what is necessary? You should assess fetal heart rate. Why oxytocin is given? Oxytocin always increases the uterine contraction that enhance for normal labor. Okay, what are the exact true signs for labor? True signs. True sign of labor. Okay, എന്തൊക്കെയാണ്? It is cervical dilation. Okay, it is and effacement. Okay, രണ്ട് കാര്യമാണ്, ഡയലേഷനും അതുപോലെ ഇഫേസ്മെന്റും. cervical dilation അതുപോലെ